Good evening IWD. कैसे हो आप सब लोग? This is Reema live from Harley Medical Center talking with a specialist gynae and a specialist OB-GYN, basically Dr. Namrata Jadhav, who's going to join us for a very important topic that we are all going to discuss today. But before that, if you are watching this live, can you say a big hello? So that I know we are audible, we are visible, my voice is clear, the video is all clear. Hi Kamla, thank you for joining. Hi Shuchi, how are you? Say hello. Girls, January was the cervical cancer awareness month. We've just finished it, and I think we wanted to start February on a note of raising awareness around this special cause. I am at Harley International Medical Center, joined by Dr. Namrata Jadhav, who's going to do her introduction very, very soon. And we are here to discuss and have a very informative session about talking all about pap smears, HPV vaccines, and the medicals. So there you go. I can see a lot of hellos coming from us. Hello Spitna ji. Hello Shuchi. Hi Sushma. Hello Amarjeet. Hello everybody. So girls, let's start with your introduction, doctor.
Perfect.
Please tell us a little bit more about yourself and your background.
Hello everyone, good evening. This is Dr. Namrata Jadhav Budraja. I'm working as a specialist OBGY at Harley International Medical Clinic. So we have a clinic here where we see the patients, the deliveries and surgeries we have been doing in Aster and Medcare hospitals. Now today, firstly I have to thank Reema ji for giving us this opportunity. I mean, I myself am a member of this group. I've seen the smallest queries to the biggest problems sorted within minutes with our active family members. It's a big platform for all the businesses out there, and you are a true inspiration, Reema ji. I'm
Thank you. Thank you. That's lovely. Yes. That's amazing. And coming from such an amazingly qualified doctor, I feel good that we are making an impact in the lives of Indian women in UAE and Dubai, as we say. There we go. Let's kick off with some of the interesting questions we have here. Before we move on, I am going to say this is going to be a very open session. Please feel free to ask your questions if you have concerns, anything. Also keep in mind, we are giving the first 20 people who respond to our form are going to get free health checkups. Absolutely free health checkups for IWD. My colleagues are going to share the form in the comments again and again. Please make sure you fill up the form, and 20 of you can come to the clinic, see Dr. Namrata here and talk about all your concerns. Our first question here is, what is cervical cancer? Please can you tell us a little bit more about it and why women should be aware about it?
Perfect. Exactly. I was also going to start my topic with this only, that what is cervical cancer and why we are talking about this today. So the cervical cancer is the fourth common cancer in women. First being breast, second being the lung cancer, third is colorectal cancer, fourth is cervical cancer. Now 6 lakh women are diagnosed every year, and 3.5 lakh women are losing battle with this cancer every year worldwide. The age group for this diagnosis is around 25 to 45. Although with the pap smear and the other screening methods, this incidence is much lesser, right? So why we are discussing is pretty much clear now. Now let's see what is cervical cancer. Believe me, when the patient comes in the clinic and when I ask about it, the pap smear has been done, the facial expressions are like as if they have never heard it, and they would tell us that yeah, we have never heard of this term, and it really pinches. So around 60% patients would say they have never heard it, 20% would say they have done in few past years, they have no records of it, 10 to 15% would only say that yes, they have been following it. So let's see why we want to promote this today. Yeah. So what is cervical cancer? So this is the uterus. This is where the baby would stay. This is the vagina. The part between the uterus and the vagina is this small cervix. This cervix has got 2 cells basically, and they kind of meet at one point. When the female baby is born, mother's hormones are there, which cause this line to be outside here, down. Now when the mother's hormones go out of the system, this line goes inside. Again at the time of puberty, with our hormones getting up, again it comes out. With many infections all around, with deliveries happening, abortions happening, this joining undergoes tremendous changes all the time and is susceptible for the infection. Again, perimenopausal, menopausal time is again a roller coaster ride with hormones. So that time is a time when you should be doing every 3 yearly screening, because this lining, which is adjoining lining of these two surfaces, is very important, as that is more susceptible for the cancerous changes or the viral infections or other things. So how it goes is, the normal cervix, when we look, it looks like something like this, which is pink, regular, healthy, does not bleed on touch. When we are doing examination and we see something like this, which is a ulcer, your gynae will tell us, please go ahead with cervical pap smear screenings, HPV testing, because this can still be reversed to this. But if you are not taking care, this can lead to invasive cancers, which will have bleeding, intermenstrual, after coital bleed, foul smelling discharges, lower back pain, lower abdominal pain. These would be the symptoms then. Okay.
Great. So I hope that clarifies, firstly, talking about what is cervical cancer. I'm going to quickly take up and have a look at the questions and say hello to everybody who has joined us. Hi, Shona Arshad. I think that's Sonali, right? If I guessed it. Hi, Amarjeet ji. Hello, Sulakshana. How are you? Neha Amit Bhatia is asking us a question. Which medical center are you?
So we are in Harley Medical International Clinic. We have got 2 branches. One is at Mankul and one is at Barsha. We have many specialities here, so please drop in.
Yes. So in addition to gynae, I think they cover a lot of other specialities. So you can visit the clinic for other concerns also. We are right now in the Mankul branch doing our live from here. Hitiksha says hello. Sushma ji has a question. Please let us know about HPV for teenagers, safe or unsafe. We're going to come that question. That is exactly the question in our list. So I will take it up. Shona is asking which hospital. We just told you we are Harley International Medical Clinic based in Mankul and Al Barsha. UTI is connected to this.
UTI would basically lead to lower genital tract infection. If that is going to the vaginal end and vaginal infections are becoming recurrent, then yes.
Yes. All right. Great. And I'm going to say hi, Cherry. Hi, Nilofer. Hello, Shivani. Is an unusual period pain a symptom too of cervical cancer?
Unusual period pain is kind of not related. It could be because of the fibroid, it could be because of the cyst, but if you're sexually active, then yes, might as well get cervical screening done so that we are assured that it is not because of this.
Great. Shona has a question. Last year I removed my uterus. After removal I'm getting some problems.
Okay, perfect. We have this question also, in fact, that after removal of the uterus, if at all your uterus has been removed because of the cervical condition, as they must have said your pap smear is bad or HPV infection is there or it doesn't look healthy, then you need to still continue with the pap smear. Otherwise, after hysterectomy, there's no role of pap smear as such.
All right, lovely. Let's move on to our next question, and we will keep posting your questions in the comment. We will come back to all of them, but let me get through my list first. My next question is pap smear painful?
All right, yeah, everybody would probably chicken out because of that. Yes, but I'm going to show you. So pap smear has 2 types of doing it. One was a conventional type and one is a liquid-based cytology. So conventional type used to use that wooden spatulas where you need to scrape the cervix and probably would be a little painful. But now in Harley also we are using this small brush. It just goes here, takes the cell and we are out. So even if I say it's painful, I think you will not believe me. No, it is not painful.
So there you go. It's not painful and I think you should all get it done. Now let's talk about HPV vaccinations. Can you just tell us a little bit more about HPV vaccinations? Who is it for? What do they cover? Why we should take it?
Perfect. So the cervical cancer, majority of the time, is mainly caused by this HPV infection. HPV has got 2 types. One is a low risk type, one is a high risk type. So low risk type is associated with genital warts, and high risk type is mainly associated with the cervical cancer. Basically, cervical cancer, vaginal cancer, vulval cancer, anal cancer, oropharyngeal cancer. All these cancers can be caused by HPV infections. And in males, it does cause penile cancer, anal cancer, and the oropharyngeal cancer. Yes, you heard it right. It causes cancers in males too. So this vaccine, basically, we have got 3 types of vaccine in the market right now. One is Cervarix. This gives protection against 2 major viruses which are most commonly associated with this cancer, number 16 and number 18. Now the second vaccine that we have is Gardasil. That gives protection against 4 viruses. 2 are low risk and 2 are high risk. So those are 6, 11, 16, 18. And there is one more vaccine since 2016 in the market. This is G9. That gives protection against 9 type of viruses. So when we are taking this virus vaccine, we are sure that the protection against those viruses, the strains which are there in that type, is going to be 100%. So the seroconversion after vaccine is seen almost 100%. Also, it gives a cross immunity against the other types of vaccines, other types of viruses, right? So, yeah, over to
Lovely.
you.
That's important information about HPV vaccines. If you're watching this live, if you're liking our discussion, can I get a big yes? So that we know it's an important session. It is, you are getting genuine information. Please type your questions in the comments and we will take them up before the live finishes. We are also sharing a form in our comments section, which gives you free tests at the center that you can come. 20 Indian women in Dubai will get to come to and meet Dr. Ramrita for completely free for their tests. So there we go. Amazing. My next question is, we talked about HPV vaccination. What's the age we should be getting it?
So the ideal age would start from 9 to 26. But yes, now the cutoff is not 26 anymore. This new G9, the Gardasil 9, is given up to 45 years of age. And when we are giving from 11 to 14 years, only 2 doses are required. One, and the second dose will be between 6 to 12 months of the first shot. And if we are giving the vaccine after 15 years, there are 3 shots till the age of 45. So you will ask me whether only females should take it or the males can also take the vaccine. Yes, males can also take the vaccine. In fact, in UK, it is given to females and males as a vaccination protocol. If you're giving it to males, of course, they are also protected from penile cancer, anal cancer, oropharyngeal cancer, and indirectly you're protecting the females also. So yes,
Males and females should get the
both
vaccine.
should be getting the vaccine.
So it's great. And our next question is, what if HPV infection exists in the body? Should we still take the vaccine?
Yeah. So HPV vaccine is not a treatable thing. I mean, it's not the medicine for the vaccine, which is the virus which is already there in the body, but it will still protect you from the other viruses, other type of viruses. So HPV is not just one virus. There are n number of viruses, numbers of viruses. Even if you have one type, it can still protect you from other type of viruses. So yes. Always a good
Lovely.
thing.
So always, you definitely, if you haven't taken your HPV vaccine and if you fall in the age bracket that has been recommended by the doctor, please do go see your gynae today. And some of you, and 20 of you, can come here for a free test with Dr. Namrata. The form has already been shared in the comments, so go fill it now to be the top 20. There we go. I'm just gonna look at the questions. Nilofer has a question: is heavy periods a symptom of cervical cancer?
Heavy periods might not be the symptom of cervical cancer directly, but yes, you need to go and do the ultrasound, pap smear, of course, one of them. There could be another reasons, say the lining could be thick, there could be a fibroid, there could be a cyst, and cervical erosion can also lead to the menstrual irregularities and heavy flow, but there are other chances of the heavy flow more than the cervical cancer.
Okay, so there you go. So I think Nilofer ji, this is a sign you should go see the gynae immediately. Hello Mukta, hi, I can see you watching. Thank you for all the yeses, girls. I'm loving that. Thank you for your response. Keep the questions coming. I'm going to take up the next question from Kritika Ramesh, which says, what is the frequency of these vaccines?
Perfect. So depends upon which vaccine are we taking. If we are taking the vaccine which covers only 2 strains, the dose is going to be 0, 1, 6. And if we are taking the Gardasil or G9, it is 0, 2, 6. So 3 doses altogether. If you're giving before 15 years of age, it's only two doses.
Great. I hope that answers your question, Kritika ji. I am loving all the yeses. Thank you so much. Shalini, she has a question. Is there an age limit for us getting the vaccine?
Yes, Shalini ji. So the vaccine ideally was, when it was planned in 2006, it was till the age of 26, but now the spectrum has been moved from 26 to 45. You can take safely till the age of 45.
Till the age of 45. There you go. So Lakshana ji has a question. Who should take the HPV vaccinations? We did cover it in if you go back the live a little bit a couple of minutes ago, but if you can just tell us in brief, doctor, who should take the HPV vaccination?
HPV vaccination has to be taken by everyone, especially the young girls. you are protecting your young girls from the cervical cancer, and there is no booster as of now. So it's kind of lifelong immunity that you can give with just 2 doses if you're giving it before 15 years. And of course, even males, we have discussed about that, even those are the candidates whom you can really give this vaccination. Of course, the high risk patients, if you ask me, are going to be those who start early sexual life, they have multiple partners, maybe PIDs, the pelvic inflammatory diseases, multiple pregnancies, abortions, or OCPL use for a longer time. All these can be the high risk factors. Not getting screened is one of them, and smoking is one of them. If you have other diseases such as which decreases your immunity, HIV, or you're on any other pills for other medications, immunosuppressant pills, then you are the ideal candidate for it, even if you've crossed 26 years of age.
There you go, girls. If you fall in any of those categories or somebody in your family needs to see a gynae soon, please take action quickly. Moving on to our next questions. Lavina Chi has a question. Please explain the role of UTI in this disease.
Yeah, so honestly, the UTI is the urogenital tract, which is a separate tract than the vaginal canal itself. But again, recurrent UTIs can have this, local inflammation, the skin gets irritated, you can have candidiasis, the fungal infection outside. As such, directly does not have impact on it, but recurrent vaginitis, if that is causing vaginal infections and touching our cell lining, which we discussed about, then yes, it can trigger the cervical changes, not immediately, eventually. UTI does not have HPV virus in this, but that any skin which is normal is less likely to get infected rather than which is eroded. So the eroded or the ulcer or the breakthrough lining is always highly potential to get other infections. Local immunity less would be highly potential to get other infections. So directly it does not have a relation to, but again, why to have the UTI is also recurrent. We have treatments for that as well. Please come.
Yes, I think if you have recurrent UTIs, I'm at least hearing you should go see a doctor and find out the cause.
Yes, the cause.
Yes. We have a question. I got heavy non-stop bleeding before my operation and got fibroids in my uterus. Is it possible to come back for a checkup?
Yes, of course, you can always come back for the checkup, because yes, even if the uterus is removed, the ovaries, we have no idea about the ovaries right now, as you have mentioned. So if the ovaries are still there, we need to have a checkup for those ovaries, as they can also have a cyst. And uterus removed for fibroid need not undergo a pap smear test, but we can always have a quick check about the vault and how the things are in place or no.
Right. And we are giving 20 free checkups along with this live, so you need to sign up on the Google form which has been shared in the comments. Hi Neeta, hello. I'm just looking through the comments. Hitiksha has a question. If one has thyroid, PCOD, is it still advisable to take the vaccine?
Yeah, Hitiksha, so this PCOS, PCOD, thyroid abnormalities have got no contraindication with the vaccine. The only contraindication for the vaccine is pregnancy, because we are not aware of it, whether it is safe or no right now. And the second contraindication is if you're allergic to this vaccine which you have taken before, like first shot has been taken and you had severe allergy, then only we say no vaccine. Otherwise, even if mild fever, you can still take the vaccine. Even if you have a febrile condition and your vaccine is due on that day, you can still take it. Thyroid, PCO, or other hormonal imbalances has no connection or no contraindication for this vaccine.
Great. I hope that answers your question, Hitiksha. Kritika says, thank you. Rachna ji has a question. For boys HPV, what age group do we take our sons to gynae to?
Yeah, so boys, they can come to us, they can go to pediatrician. If they are less than 15 years, they need 2 shots. If they are more than 15 years, then it is going to be just like an adult one, 3 shots.
Yes, the boys can come to gynaes and pediatricians if you want to. So, Mukta says we are late. Sumeda says my daughter is 14. So, which vaccination shall I proceed with?
Perfect. So she's just 14, right age group. So G9 is the new vaccine, and in that, for that matter, in fact, US is only giving G9 now, which is covering maximum number of viruses. So G9 is the vaccine for her. We can give one right away, and the second shot after within the 6 to 12 months of interval.
Great. Sumeda, I hope that answers your question. Amarjeet Kaur has a question. Does it impact if a lady doesn't get pregnant, deliver baby?
This has any impact? If no, it does not have any impact.
Are they correlated?
No, there is no correlation. But yeah, we say if you've taken a vaccine, not to conceive for next 6 months. But in case the accidental pregnancy has happened, there is no such thing that you need to abort it or something. You can still continue with the pregnancy.
Great. Let's look through. We're just looking through the comments. So, girls, if you have comments, please type in. Lavina ji says, thank you for this live session. Very helpful. I think all thanks to Dr. Namrata there.
We have to thank you. Thank you.
There you go. Kritika ji has a question. You mentioned 2 levels of infections. One was the low level. Could you explain that a little bit more about the infection?
Okay.
So we'll take it up again.
Yeah. So what I was talking about that is not the level of infection. So what happens is when the cervix is there, it says it's 2.5 centimeters, right? And it is made up of 2 type of cells, and these 2 type of cells meet at one place. Now this place comes outside whenever there are female hormones. So at the time when the baby girl is born, she has mother's hormone. So that time again it is out. When her hormones are withdrawn from the body, it's the time again it goes up here in the cervical canal. So first it is outside, then it goes up again inside. Then eventually when she gets puberty and her hormones, it comes outside. So what I'm trying to tell you is that small thin line has to undergo so many changes throughout our ages. So the recommended pap smear screening is every 3 years. It should start by age of 21, and 21 to 29 every 3 year pap smear, and from 30 to 65 HPV and pap smear every 5 years. This is the recommended protocol. But if the HPV is not done because in majority of insurances might not cover it, in that case we can still stick to 3 yearly pap smear routine.
Great. So I'm just curious now. Comment no if you have, or comment yes that you've not had a pap smear in the last 3 years.
Oh, that's amazing.
Yeah.
Now you
I just want to see that people watching the live. I would like to know how many of us. Actually, I'll be honest. I'm the first one. My daughter is 4 years old. My gynae at that time did recommend that you should come back for a pap smear. I haven't been back in the last 3 years. So guilty here. But I want to see people watching this live. Please say a yes if you are one of those just like me who need to go to see a gynae very, very soon and need to get the pap smear done. Because this is for us. This is your own health. If you are well, your family is doing well. If you are not doing well, the health starts from the lady of the house. So there we go. I want to see how many yeses we get. Okay, we'll move on with the questions while I wait for your yeses. Shona ji is saying thank you. Hitiksha says thank you. Sumeda says thank you. Lovely. Okay, we have a question from Ketki. Hi, when should MCV be given to a girl of 12 years?
Yeah, so the HPV vaccine, I guess you mean.
Yeah.
So that you can give it now also. So she's in appropriate age for it, and she will need only 2 shots. One, you can give it like as soon as it's possible, not related to menstruation. You can give it in the menstruation, you can give it after menstruation, no problems whatsoever. You can start it right now.
So there you go, Ketki ji. I hope that answers your question. You need to go see a gynae very soon with your daughter. Amarjeet Kaur says, thank you, Reema, for arranging this. And thank you, Dr. Namrata. Absolutely. We're very, very, very thankful to Dr. Namrata here. Anjali says, very informative. And we're getting a yes. Never had it. I think we are getting... Okay, I'm moving down a long list of comments which says yes, and I think
that's amazing.
I think it's a wake up call for all of us. Your health is very important as much as the health of your family. So please book your next gynae appointment now or today, very, very soon. And also we are giving 20 free health checkups from this clinic from Dr. Namrata. We're going to share the form again in the comments now. So please make sure be one of the top first 20 people who will fill up the form will get the free health checkup. So try doing it now. We're going to take up the questions in the meantime. We have a question from Dexter's Natural. What about 9-year-old girls? Do I need to give her 2?
Yeah, so the vaccination protocol actually starts with 9, but I would say 11 would be the best idea. 11 to 14 is the best age group to give this vaccine.
Great. Let's move on to the next question. Thank you, Madhuri. Thank you, Ji, so much. Neeta Ji has a question. She's our favorite. So there you go. Neeta Ji says, I have done pap smear only once in 55 years of my age.
Yeah, see, mammogram every 2 years as my mom is a breast cancer patient.
Yes.
Yeah, but again, as this mammogram you have been doing, please do this pap smear every 3 years. Not early, not early, not too early, every 3 years till the age of 65.
So there you go, Neetaji. It's time for a pap smear. Huh? Okay. Zeba says, already done my pap smear. I am so proud of you.
Seriously, we are proud of you.
You are our rock star, Zeba. If you're watching this, please give yourself a pat on the back. I am proud of you. You're probably the only comment I've got which says I've done my pap smear. So there we go. We have another question from Madhuri. We says, what about 48 years? Do we need to take it?
So what those things would depend upon the condition. It's better to visit so that we can have a quick check. We can have pap smear, the HPV testing done. If the HPV comes negative, we can always give it. If at all it comes positive, then you need not take it. Also, the question comes that why not before 21 years of age? Why pap smear should not be done before 21 years of age? Because our body immunity is so high that it removes this viral infection out of the system. So pap smear and other tests, the HPV tests, are recommended only after 21 years of age.
Great. Okay, that brings us to the end of our comments. Last few questions, comments, if you have for Dr. Namrata, please type them now. In the meantime, doctor, we've talked about pap smear, cervical cancer, HPV. Any other thing that we should be covering regarding women's health? Anything I haven't covered?
Yes.
Prevention?
So, prevention, yeah, prevention.
Yeah.
So prevention would be again getting screened, taking vaccines, limiting the smoking, good exercise, say around 40-50 minutes exercise 3 times a week.
Yeah,
Should be
follow my fitness session.
Yeah, please do that. Yeah, it's amazing, by the way. Yeah, so yeah, that is one of the things that keep your immunity good. Limit the sexual partners, of course. Those are some, keeping good hygiene. All these are the prevention protocols. Of course, when your doctor would always call you after 6 months of delivery for the visit. Do visit that
Yes.
6 month post delivery, because that is a time when doctor would take a pap smear. That is a time when doctor would tell you whether you will need a tightening, other things which are there. There is RF given at that time. If you're taking that radio frequency thing sessions, there are just 3 sessions for that, and it will help in tightening of the vagina, which has become lax because of the baby which has come from there. So again, very important session, as if you're taking that timely, you will not have problems of leaking urine while sneezing, coughing. You will not have problem of something coming out with like the vagina or the uterus descending down, and the tightening is there. So is a good idea to do that. Do not skip that 6 month visit post delivery for sure.
Great. I can see 2 questions coming up. We'll take them up. We have a question from Kritika. Do genetic and racial conditions influence the impact of this virus and hence the cancer?
So the genetic and racial conditions won't have direct impact, but there are certain countries where this HPV is more, and the young girls and the young boys would have it more in their body, not because of the genetic predisposition, but because of the behavioral pattern. So that's the thing, but otherwise it directly does not have impact. The genetic does not have direct impact of this.
Okay. And I think we had another question. In the sense, it's seen more amongst people of certain. We've talked about this one, right?
Yes,
So, Kritika,
yes,
I think
yes,
we've covered, or doctors covered, that genetics or certain races don't have affinity to this thing. Okay, great. I hope that was helpful for all of you. Any message for IWD, doctor, as we close this session?
Yeah, so I hope the reversal of ratio which we spoke
Yes.
about is going to be
Yes.
there for sure. And yes, get screened for all these tests and stay fit.
Lovely. Thank you, IWD, for this for joining this session, and I hope you got to learn about your health, about our health, and the family's health. Start from there. Essentially, please book your gynae appointments today. Now, I can't stress it more. You need to do it now. If you if you want to come see Dr. Namrata, we can share her number. We can share her clinic number. Also, with you on the top of this live, you can book a direct appointment. Also, if you don't want to go through us, that's completely fine. You can search for Harley International Medical Center. Google it. The phone numbers are available. Dr. Namrata sits in the Mankul branch, right?
Branch,
Yes, and she is in addition to cervical cancer and all this, she is a normal gynae. So if you're expecting a little baby, you can come see her too. She I will post the pictures later, but she has a lovely wall with all the babies she's delivered, which is really cute. So I'm going to share that later on. But thank you, IWD, for joining this live, and have a lovely evening, everybody.